scars from a pathologist at Providence Health led to a series of women receiving cancer-free lab results, only to later discover they actually did have cancer.
This is a story we first brought you earlier this year right here on Fox 12, and today investigative reporter Ezra Kaplan has an update. He's been leading the reporting on the story, joins us now live with the very latest. Ezra, good morning.
It's been 2 months since we first reported this story, and while we have learned a great deal from the patients affected, Providence has yet to answer many of our questions. Meanwhile, those patients are dealing with the repercussions resulting from these pathology errors, and the scars left behind are impossible to ignore. I first sat down with Jessica Vickers when she had just found out that her cancer-free lab results were wrong.
My primary care doctor, because he knows my history, called me like literally almost in tears. Like, I don't even know how to tell you this. I don't want to, but I need to tell you that your pathology results that you got done last year are wrong, and that you have some form of cancer, and we're trying to get you into an oncologist and get you scheduled so that we can explain this more to you and find out exactly what's going on.
With her family history of breast cancer and year of delayed treatment due to the pathology error, she and her surgeon decided to do a double mastectomy. We sat down again as she recovered and prepared for her upcoming reconstruction.
Did the doctors say what could have been different had this been caught earlier?
I probably wouldn't have had to do the bilateral mastectomy, or wouldn't have made that choice, not having cancer or having a cancer diagnosis. Like, I probably would have maybe just done a lumpectomy, but because of waiting a year and not knowing how big or how bad it could be or would be, I was like, no, I want everything gone. I'm not taking any risks. From what the surgeon said, that was my best option. That was my best option to hopefully avoid any other treatments, is if they could get everything off during surgery. So my risk of getting any kind of more cancer went from 67% chance to 10% by doing the surgery.
Jessica was one of nearly a dozen patients who had lab results incorrectly reviewed by Dr. Jeffrey Harder, a pathologist at Providence. This is according to interviews and medical records reviewed by the Fox 12 Investigates team. Providence has not publicly identified the doctor in question. We have repeatedly reached out to Harder, but have not been able to reach him for comment. He is no longer providing services at Providence. In the 2 months since Fox 12 first reported this story, Providence has continued to decline to make a representative available for an interview. Additionally, the hospital system has not disclosed the number of patients impacted, nor details on how the errors came to be in the first place.
The surgeons and people that I'm dealing with, and like the nurses and the MAs, have been amazing. Above that, I haven't heard anything. They haven't talked to me about anything. I mean, obviously, they probably won't now that they think we're talking to lawyers. I feel like they should be trying to reach out or trying to help us, and it doesn't seem like they are. I don't know. Maybe that's how this works. I've never been through this before, so I have no idea, but I feel like they should be doing more than they are.
At least 2 lawyers are currently working with patients like Jessica and planning to bring legal action against the hospital system.
Is there anything that you're hoping to see change?
Better communication. I think that's the biggest thing they can do, is communicate with people better, explain things better. I mean, even if it's an error on your part, it's better to own it and accept it and fix it than hide from it.
A devastating series of errors from one doctor, leaving patients with serious questions and a hospital system failing to answer. While Providence continues to decline our requests for interviews, they did provide a slightly updated statement that reads in part, consistent with our mission and core values, Providence continues to be focused on providing excellent care for our patients. When concerns about some of our pathology results surfaced during our own quality review process, we began a thorough analysis to make sure we identified and reached out to the affected patients and their clinicians. Caring for these patients continues to be our focus and priority. Again, we apologize for any concerns this causes our patients and their family.
Ezra, I mean, our heart just breaks for this woman, but you talked to others as well. There are many others impacted. Have you been able to follow up with them and see how they're doing?
So everybody that we've talked to along the way for this story, we stay in touch with, we check in on them, make sure, see how they're doing. In general, they're in various stages. Some of them are getting treatments to get cancerous cells removed. Others are still working on a treatment plan with their providers.
And not all breast cancer, right?
No, not all breast cancer. So this also included thyroid biopsies, cervical cell biopsies, and breast biopsies.
And let's talk about this pathologist. We know that he's no longer working with Providence, but is he working as a pathologist elsewhere?
You know, we don't know much about his employment, but what we do know is from public records, his license to practice has lapsed as of last year, so he can't be practicing, at least not legally.
Boy, we're so glad to get an update. We just sure wish her well and the other patients as well dealing with this. Ezra, thank you.